Working to get answers for you and learn more about some big developments that happened today in St. Louis County. So this evening, we are taking your questions straight to St. Louis County Executive Dr. Sam Page, joining us live this evening. Dr. Page, thank you for your time.
Good evening. Well,
today the county, as you know, had its largest one-day jump in deaths during this pandemic, reporting 20 deaths in the last 24 hours. Give us an idea why the situation is so bad in the county and really doesn't appear to be getting much better.
Well, I think what we're seeing is some irregular reporting of deaths because of the process that's been established. Some days they'll be lower and some days they'll be a lot higher. What we really have to watch is the trend over time. And what we're seeing now in St. Louis County, is, as Dr. Garza mentioned earlier today, is that we're starting to reach our peak, which is really a plateau. And then we can expect this to start to head in the other direction over the next few days.
So am I sensing from you tonight optimism in these numbers?
Yes, absolutely. We have to be careful with making a decision based on a single data point or a single event or a single number, but rather look at the trends. And you know, we're not out of the woods yet. We're still in a very tough place in St. Louis County, but we are heading in the right direction.
Today you reopened more than half of the county's park. We're curious, what criteria did we meet that you felt that this was a safe thing to do, and is this the best decision as we're still seeing an upswing of cases?
Well, we were waiting until we could get our signage in place. We could make sure we could educate everyone on the social distancing measures that are expected. We had some park rangers out with COVID-19, 3 of them in fact, and I'm happy to report that all 3 of them are recovered and doing well and back at work.
Today, the County Council voted to give you free rein to spend more than $173 million in federal funding. What are you going to spend that money on? And explain why it's a good thing, in your opinion, to have less public scrutiny with how you spend the money.
Well, there certainly is a lot of politically charged arguments around this, as you would expect in an election year. But actually, we've set up a process that has an enormous amount of scrutiny. At stlcorona.com, there's a portal where anyone can track what's been spent and what's been obligated in this federal grant. But this is a common process for a federal grant handled by St. Louis County. Most importantly is that we've assembled a team of advisors, a former CEO of a major company here in St. Louis, a former director of the Red Cross, and others who are going to help us make sure that we follow all of the very strict federal guidelines as this COVID-19 relief fund is distributed. We'll work very closely with the council members, as I always have, and make sure their input is in part of this process, along with other elected officials and community leaders, very similar to how the Department of Human Services and the Department of Health has functioned in the past. This time, though, we recognize that this is an emergency, and we need to move quickly to get people the help that they need.
What are some of your first priorities for this money? What's top on your list?
Testing and more tests. We know that we can't begin to be where we want to be in easing social distancing rules and our stay-at-home order here in St. Louis County. We have 40% of the cases in the entire state. In St. Louis County, we've been hit harder than any other place of the state, and we need to be cautious and follow the guidance of our Metropolitan Pandemic Task Force and Dr. Garza, some of our public health officials. And when the doctors give us the go-ahead, then we'll know that it's the right time to move forward. We're all very sensitive to the economic impact of these restrictions, and I'll be making some announcements here in the coming days about the economic rescue team that I'm putting together.
Yeah, and I know you say testing, and more testing. You would want all those tests weeks and weeks ago, but what is a feasible date that will get to the point where you feel comfortable with the amount of testing we're doing in the county?
So we need tests, and we need to hire people to do contact tracing. That's very important. We need to see that our hospital systems can handle the capacity of people when they get sick. Our hospitals can't keep people from getting sick. They can only take care of them. So it's up to us to make sure we make the right decisions to keep our hospitals from being overwhelmed. So we do have to see those numbers come back down in the hospitals. We need to have more tests in our community, and we have many more people standing up testing operations every day. The challenge we have is the challenge everyone in America has. There's just not enough tests being produced right now. As far as a number, I would like to see enough tests for anyone who has symptoms to be tested. We're not quite there yet, and we need to make sure that we have contact tracing abilities, so anyone who has become in contact with someone who has COVID-19 could be alerted promptly, so they would know to watch for symptoms, to get treatment, or to be quarantined until an appropriate amount of time has passed.
This really caught our attention today. You told one of our reporters earlier this morning that this is where we are going to be for a couple of years until there is a vaccine. Elaborate on that. What did you mean by that?
So this is our new normal, is social distancing. Of course, we're going to look at the possibility of easing some of these restrictions, as every state does when the time is right, or every local community does when the time is right. But we're going to be dealing with social distancing. We're going to deal with the virus in our community moving about, and we need to make sure that it spreads in a controlled way that doesn't overwhelm our health systems and that we can manage it. But until we have a vaccine, the virus will be with us, and we need to recognize that and embrace these social distancing guidelines and find a path forward.
Yeah, a couple of years, certainly a long time. You mentioned the economic team that you are putting together in the coming days. We're going to learn new information about that. But how do we sustain our economy and our way of life? People not working, not purchasing things beyond the essentials, and not socializing like we used to.
Right. Well, this is the new normal for all of us, but we do need to get our businesses open again. We're watching those numbers very closely with hospitalizations, ICU care, and then, of course, as the testing becomes more available, we're watching those test results. But we all understand the devastating economic impact and the difficult choice we've had to make between saving lives and livelihoods. And we're working that balance very closely. And as we move forward and we find the right time, before we get there, we will start to give some of our businesses guidance on what opening might look like in St. Louis County, what some of those guidelines might be, and how they could manage social distancing in this new normal of the coronavirus in our community.
And real quickly before we let you go this evening, are you still looking at mid-May for updating us on when perhaps our stay-at-home orders might be coming to an end?
Well, that's our target right now, is a more detailed investigation by mid-May. But honestly, we're looking at these numbers every day. We're looking at our testing results. We're following Dr. Garza's report from the Pandemic Task Force. And we're watching our ability to purchase supplies. And we've got a proposal out to purchase more tests. We're going to be working with our surrounding jurisdictions to try and purchase tests, but we're just not there yet.
All right, Dr. Page, thank you so much for your time this evening. We appreciate it.
Yeah, thank you.